رسول إمام بنور الصفا.
It's Tuesday, and on Tuesdays we talk about mums, bums, and little ones. And we're going to be talking about the first signs that your little one may be getting the flu. Now, the flu or influenza is a common viral infection that affects the respiratory system. And let's face it, children are particularly susceptible to the flu. And recognizing the early signs can help in managing the illness and, of course, effectively preventing it from spreading. So, early detection allows for timely medical intervention, which can mitigate the severity of symptoms and complications. Now, some of the first signs that your child may be getting the flu is a fever, of course. And one of the earliest and most common signs of the flu is a sudden high fever. When we talk about a high fever, it's about 38.3 degrees Celsius, and it may be accompanied by chills as well. Then you get fatigue and weakness. There could be the cough, the body aches, headache, sore throat, nasal congestion, chills, also gastrointestinal symptoms as well. Now, some children may experience the nausea, the vomiting, diarrhea, all these and more common in younger children, although these are more common definitely common in younger children. But you know what? To tell us more about this topic, we are joined in the studio now by Dr Mhlongo, and she's going to be chatting to us more. Good morning, Dr Mhlongo. Welcome back to Urban Women.
Good morning to you and the listeners. It's always a pleasure to be part of the show.
Wonderful. Now, you know, I think it's so common when our little ones go to preschool or daycare, things like that, they're always picking up the flu, right? And sometimes we're not sure, should we be worried about this or not? So let's chat more. When should I actually bring my child in for a flu test or medical evaluation? You being a doctor, what's your advice?
Importantly, flu is something that we can treat at home, and a lot of mothers would agree that you go over the counter and get some flu meds for the child.
Right.
But like how you've highlighted the temperature, if the child has a persistent temperature of 38.5 and above, that's not responding to your antipyretics like your Panado and the stuff that you give at home to try and reduce the fever, then it's a sign that the child should be brought for medical attention and just proper checkup.
Right. With regards to treatment, what would you say as the best treatments or the treatments that are available for children with flu?
So importantly, it depends on the cause of the flu and also on whether there's complications of flu already, like you mentioned, some of the gastrointestinal symptoms. So if really in 3 days' time the child is still spiking a fever, it's important for the child to undergo medical treatment. There are various treatment options, including antivirals, like your Tamiflu, which you can only access via prescription.
Right.
And if need be, antibiotics are, the next level of treatment if there's especially complications.
Right.
And all those can only obviously be prescribed by a medical professional.
Definitely. I know some people would say, you have the flu? Just take this antibiotic. I have some in my cupboard.
Yeah, no, it's important, to keep it for long. Also, like, for example, if the child already has diarrhea, you may actually worsen the symptoms by, self-treating your child at home.
Very true. Very true. Now, with regards to having a sick child at home, how can we actually keep them comfortable at home?
So importantly, hydration is the mainstay of home treatment. And we've mentioned fever, and we find a lot of children being rushed in the emergency department unnecessarily because fever is something that parents can treat and manage at home. So it's important to regularly check the child's fever, but also just make sure that the child is, less stressed. If the child's fever is extremely high, mom can also just do what we call tepid sponging, where they can dampen a towel in just lukewarm water and tap the baby expose their body so that the temperature can come down.
So there's no specific body parts that we should concentrate on?
Importantly, the torso and the forehead and the torso. So like the upper body.
Okay. Old wives' tales, I know they say vinegar under the feet and under the arms. So I was just wondering. So it's just forehead, torso, we good? to cool them down.
To cool them down, and also the limbs, like the arms and because importantly it's the water that you now apply. It just
Correct.
helps the body to perspire and reduce that core temperature and
Yes.
the peripheral temperature as well.
Indeed, makes a lot of sense. What should I do, doctor, or what should I watch out for that could probably indicate that there's a need for an urgent case?
So severe flu complications such as difficulty in breathing, and we've mentioned persistent fever, and also with the fever comes convulsions, which is the most important
Yes.
thing to prevent and also to look out for in children.
Mhm.
So if the child is also severely dehydrated, not drinking anything, there's something we call danger sign. So when we're assessing babies, so also, a child who's got chest in drawings is a sign that the child should be taken for medical care urgently.
Okay, all right. Now, often, I think, especially after COVID, we are also wary when somebody gets the flu. We don't want to get it. But with regards to kids at home having the flu, what can we do in order to make sure that it doesn't spread to other family members?
So importantly, the principles that we've learned so far in terms of just public health during the COVID times is something that we should instill in our cultures, in our home, where when somebody's ill, rather put on the mask, because we've seen a lot of viral flu.
Okay.
In fact, currently this season with a lot of children and elderly being hospitalized,
Okay.
requiring ventilation and ICU care. So it's important to just continue to practice hand hygiene with hand washing, sanitizing, and importantly, I will just double stress that wearing a mask if you're not feeling well.
Okay, there we go. So mask up if you're not feeling well. And I think especially as adults, if you're going out and working, so let's be responsible. Thank you so much for that. I think parents do get a little stressed when their kids are sick because they're more clingy, they're more needy. And if we can just nip that in the bud, it makes life so much easier, isn't it, Doctor?
Definitely.
Absolutely wonderful connecting with you. Your take-home message for our Urban Woman listeners this morning.
So importantly, mothers are the cornerstone when it comes to home treatment, and as we've stated that preventing hospitalization and complications of flu is vital. So that by just getting some medication over the counter and start treating flu as early as possible.
Yeah, don't wait for it to kick in.
Definitely.
I think sometimes that's what we do. We think it will go away. But those early signs, they are there for a reason. Thank you so much for that, Doctor. We do wish you have a lovely day further until we connect again. Bye for now.
Bye.
That was Dr Mhlongo chatting with us about the early signs that your child might be getting the flu. And with so much as mothers, we have to see and tend to so much. Definitely, we want to pay attention to that so that we can help them to get better and not worse. That is